Hi everyone, my name is Nurse C. I'm a special intensive care nurse here in the UK and a public health specialist. And I really enjoy healthcare strategy, health systems, kind of the public health level. And I decided today to kind of share with you some of the 10 reasons why I came from Portugal to the UK to do nursing, and perhaps help you decide whether you think UK is a good option for you if you're considering it, and see if you like it. So I have my papers here, so just be aware that I'm just trying to remember everything, and tell you a little bit more about my experience here. I've been here for 10 years. Be aware that when I came here, there was no Brexit whatsoever. It was so much easier, and obviously you had much more freedom to do what you want. And now it's not just like that, so you have to be extremely careful in which hospital do you apply because of the visas, and to make sure that the hospital that you apply to has good quality of care, has good staffing ratios, so then you don't end up, has a good culture, so then you don't end up in a situation that is not very pleasant. So the first reason is that UK, compared with many countries, has many opportunities for you to learn and develop. So either clinically, managerial, academic. Compared with many countries, this is a fantastic opportunity, really. Basically, for example, when you are clinically, they will give you some CPD training. For example, when I was in intensive care, I did my intensive care specialist course, which was a kind of a level 7 training, and that gave me a little bit more advanced training in critical care. For example, if you want to be an advanced nurse practitioner, here you can get your master's paid for. So I think it's good if you want to develop a career in clinical practice. I think here there's lots of opportunities. If you want to follow more like my pathway of more strategic and innovation and improvement, is a little bit harder. It's much harder actually, because the opportunities are not there yet for us. You have to do a lot of jiggling around. But I think you have good schools here that can teach you the skill set, so then you can develop your own opportunities. That's what I would suggest. The other thing is that if you want to become an academic here, like a clinical academic, the National Institute for Health Research has it's incredible what they offer to you, because you can do a PhD basically on your nursing salary. So you don't get there anywhere. Majority of the PhDs pay you like 17k, 18k, and you can be earning doing a PhD 35k or 40k. You know, I think that's really a good opportunity if you want to do a PhD here and to advance your career within the academic system, because you know they are competitive, but I think there are good options. You don't get this almost anywhere that I know of. Then the other thing is that you can choose the hospital and the unit that you work for. I mean, in Portugal, for example, sometimes you can't choose the hospitals, neither the units, and the specialty that you work for is like, oh, internal medicine needs you. You probably get stuck there for years until you manage to transition for the area that you want to work for. Here I can just pick and choose the area that I want to work for, or even try. I mean, fed up of ITU, go to A&E, fed up of A&E, go to health protection. I don't know. There's so many opportunities here that you can try a lot of things as well. I always wanted to do intensive care. Always wanted to do ECMO from a clinical perspective, not long term. So for me, it was great to come here and go straight to cardiology, then cardiothoracics, then go to ITU. It was great. I'm really grateful for those opportunities, because it allowed me to do what I wanted to do at that specific time. The other thing is because of supply and demand. I mean, the UK doesn't have enough supply of nurses, and it has a huge demand for them. I think the problem is not necessarily so straightforward as people think, oh, there's no nurses. Actually, there's lots of nurses, but the senior nurses leave. So you'll find very strangely that majority of the hospitals have very nearly qualified staff or very junior staff working in the units. Like people with, 20, 30 years of experience normally tend to be on the managerial level, or majority of them like me leave, which is quite interesting. And I was always wondering, why do they manage to do this? And I think it's because they have this business model around this, where they can get very, sorry to say, but it's true, very cheap labor from abroad. Grab them here from, Philippines, Nepal, India, Portugal as well, Italy, all those things. Very small salaries initially. They get, especially now, they get stuck in a visa. They get in a visa and then they get stuck and then they can't move on to other things, even if they don't like it. So it's a very efficient business model from a financial short-term point of view, not necessarily long-term, but that's another story for another day. And so nurses, very senior, either have moved on from nursing completely, because as I said, there's lots of opportunities here, and I'm going to tell you, there's lots of opportunities to do other courses and transition to other specific fields. Then other nurses just transition to senior management or move on to other opportunities in the community or doing other things, pharmaceuticals, working in the medical devices, or you're like me, you're just trying to figure out a way to do what you want and transition to the areas that you want to work in, and it takes time. And some agencies just do nursing agency. So here in UK there's lots of extra shifts, especially in the winter time. So there's a lot of nurses like myself for short periods chose to do agency, because you have all the flexibility in the world. You don't have to work nights or days or whatever. You just pick and choose the shifts that you want to work. Obviously there's a risk they cancel you, but I think it's wonderful, especially if you're trying to do something else and trying to transition to other fields until you get the opportunities to completely get out. And I'm on this stage where I do a few shifts a week, and I'm trying to transition towards what I really, really want to do. And it takes time. And it just takes time, takes a lot of, resilience, persistence. Is not easy. But if you have a goal, you have a purpose, I think long-term we'll get there. The thing is, also, if you want to study other things, so I wanted to do my master's in public health, or let's say you want to, you always have this dream of, studying sound engineer, and you always wanted to transition to that. It's so easy here. It's very easy, because you can do a few shifts, get a little bit of practical, then you can transition to agency for a while and do other things, so you can transition or move out completely, or, just have more flexibility, to go home and visit your parents, to travel. And a lot of nurses come here to travel, and London is a great place to be because the flights were quite cheap compared, traveling from Portugal, traveling from other parts of the world. So it's a good place to be if you want to travel for a while. So if you want to travel, you can do agency and you can have the flexibility as you want. I know a lot of people that have done that in their 20s. And also you have the opportunities to transition to other fields. I think nursing is a great opportunity to come in because there's so much demand, so it's easier to get in. But once you're here, once your visa situation is a little bit better, you can find apprenticeships, you can find other opportunities to study other degrees for free while earning and transition to another different area. So the sky is the limit, or should I say your mind is your limit. So there's a lot of other opportunities that you can pursue, and you can try to, if you want to get out of nursing, as many other nurses do, because there's not a lot of opportunities to progress further. I think the other thing is a lot of people come here, I don't know, but one of the reasons was because here the national health system is very simple. It's very similar to the Portuguese. It's not insurance based. It's financed by our taxes. So it has the same values, same principles. So I really, that was very, very important to me at the time when I came here. And I think I made a good choice because of that. And also because, they have extra pension, they have holiday pay, sick pay, and also here there's lots of opportunities for you to invest your money in tax efficient ways that, for example, in Portugal and probably in Brazil and many other countries you don't have. So you can play a little bit more with things as once you get a little bit better and more established. So this is my 10 reasons. I hope you enjoyed it and it was useful for you to make a decision. But please, 99% of you don't subscribe my channel. I really, just click on the subscribe if you found this video helpful, because it will help me a lot. And also help reach other people that are looking for the same help as you are. And I hope you enjoyed it. I'm gonna do lots more videos about this, and I've done other videos about the careers, the opportunities, scholarships. So have a look around, and I hope you found this useful. Take care. See you in the next video.